Back here in Central Florida, law enforcement and emergency responders in 4 counties are working together today on a massive training exercise.
The scenario, a coordinated series of explosions at courthouses in Orange, Osceola, Seminole, and Lake counties. ProudFit says more than 1,200 volunteers are helping with today's exercise.
We have been notified there have been explosions in front of courthouses in Seminole, Osceola, Lake, and Orange counties. There are hundreds of casualties reported. So if you would please get the all page, the overhead announcements out, I would appreciate it. I want everyone to be ready. And that's why I do what I do. I want to make sure that this hospital and all the hospitals in our system are as best prepared for what may come through or may impact us. Because I want to make sure that we're able to care for those that are in our community.
We're the only level 1 trauma center in Central Florida, and as such, it is our responsibility, it is our mission to care for the ill and injured in this area. We have to be ready for a mass casualty intake.
These are patients that are coming in with horrible injuries or life-threatening injuries, and we get to be the ones that help them feel better.
But with that requires training, it requires funding, it requires a sense of readiness. We can't ever let our guard down.
Motor vehicle accidents in workplaces, violence, those things just happen. And you really can't plan for all them. I mean, you can plan that it's going to happen, you just don't know when. So at any given time, you may go from 0 to 350 miles per hour in just a glimpse of a nanosecond.
Drills are really important because they help us identify deficiencies in our systems. What doesn't work, what do we need to change, what do we need to work on, and I think that's what makes us a great working family down there.
And again, that's part of the whole piece of being a trauma center, is ensuring that we have the team that's always available, that's trained and ready to be able to provide that care for who may come through the door at any given moment.
I mean, you have to have a certain amount of volume to have a certain amount of quality. To be at a busy trauma center where we take care of this day in and day out, multiple times a day, if you were injured, that's where you would want to go.
We do become better trained and we're more equipped to handle mass casualties or any kind of traumas, but it's all coming down to it, it's all for the patients.
When I'm back there, I think, what if I'm on that table, not them? If that table wasn't there and the team surrounding that person, that 15 to 20 people that stand around them and have designated roles and they know exactly what they want to do and need to do, it's like a symphony. If that orchestra or symphony doesn't occur, then I, my wife, my family may not be here.
You have a whole team of independent thinkers versus a team of people who, have to be told what to do. And I think the culture that we have here at Orlando Health fosters that and makes it that much easier to respond to something when everyone can just take their own initiative and feel that that is their role and do what needs to be done.
So in essence, if we watch what's happening in our community, we've got to realize that we've got to continue to build here to accommodate the need of what's going to come to us in any given time. And we just don't know. There's a huge risk. And we've got to be able to provide that mitigation effect and care for what that risk could be.
One of the most consistent traits that I see with the team members and physicians that are involved in our Level 1 Trauma Center is a desire and a commitment to always bring their best. Each day they walk in the door of our medical center recognizing the responsibility that they have to care for this community, and they do it in such incredible ways.